Hi, my name is Mary Milne, and this is my presentation on online cognitive behavioral therapy as an effective alternative to traditional cognitive behavioral therapy. I wanted to begin this presentation by discussing the importance of cognitive behavioral therapy in the treatment of obsessive compulsive disorder, otherwise known as OCD. Obsessive compulsive disorder is characterized by distressing or alarming thoughts followed up by physical or mental compulsions as a way to relieve the stress caused by these alarming thoughts. This is a global problem that affects over 70 million people worldwide. In the United States alone, over 1 in 100 individuals suffer from OCD. So chances are that either you yourself know someone who currently suffers from OCD, or you will come to know someone who suffers from OCD. Traditionally, cognitive behavioral therapy, or CBT, has been seen to be the most effective treatment. This usually means that you meet with a clinician face-to-face. However, due to a shortage of clinicians that have the skill set to administer cognitive behavioral therapy, many individuals who have OCD are not receiving the help that they need. Online cognitive behavioral therapy can combat the inaccessibility of traditional cognitive behavioral therapy and can provide a way for many more patients to receive the care that they need. In today's presentation, I will be discussing 3 specific ways in which online cognitive behavioral therapy should be considered an invaluable resource in blessing the lives of individuals who suffer from OCD. Firstly, online cognitive behavioral therapy has been found to be a powerful tool in reducing the primary symptoms of OCD. Secondly, online cognitive behavioral therapy has been found to drastically increase accessibility to treatment through video conferencing technology. Lastly, online cognitive behavioral therapy has been found to greatly improve overall quality of life through home-centered learning, specifically through improving familial relationships and understanding within the home. First, symptom reduction. Symptom reduction is a powerful way in which we can evaluate the successfulness of an OCD treatment. By looking at symptom severity from the beginning to the end of treatment, we're able to see by how much symptoms were reduced. When looking at symptom reduction of online cognitive behavioral therapy as compared to traditional face-to-face cognitive behavioral therapy, there has not been found to be a statistical difference. This means that online cognitive behavioral therapy has been found to be equally effective in reducing symptoms as traditional cognitive behavioral therapy. Continually, many patients have even showed signs of remission from OCD symptoms after one course of online cognitive behavioral therapy. By remission, I mean that they had to see at least a 35% reduction in symptoms. Over 70% of people that participated in online cognitive behavioral therapy reported having a positive experience with online cognitive behavioral therapy and did see symptom reduction. Secondly, online cognitive behavioral therapy can increase the accessibility of therapy for patients who need help. There are many ways in which this occurs. Firstly, currently, many patients who have OCD have to drive great distances in order to meet with a skilled clinician. This affects people in rural areas or people who just live in countries or places that don't have many skilled clinicians available to them. Video conferencing technology, such as we're using right now, means that a trained clinician can treat patients virtually from the comfort of their own home. With the click of a button, patients will be able to receive the care that they need without having to travel the great distances. At the same time, patients are able to meet with a clinician more often because of the fact that they are eliminating the need to drive far distances to meet with them. This means that they're able to see symptom reduction faster as they were able to meet with the clinician more often during the week. Clinicians have also reported being able to meet with more patients because they are able to access more people around the world through online technology. This means that more people with OCD are able to get the treatment that they need through online video conferencing technology. Lastly, home-centered learning through online cognitive behavioral therapy has been seen to improve the quality of life for people and individuals with OCD. This has most prevalently been found for children and adolescents within the home. Parents have reported having more feelings of empathy towards their children as they are more involved in their treatment because it's taking place in their own home. Parents have also reported being grateful for a greater skill set and greater understanding of how to help their children with their OCD compulsions both during and after treatment from learning from the skilled clinician. There's also been found to be reduced levels of stress within the home, mainly due to eliminating the need to travel great distances. Parents already have to drive their children many places such as school and extracurricular activities. Allowing their therapy to take place within the home is a big stress reliever for them. Overall, the use of online cognitive behavioral therapy has been able to link patients and clinicians together in a way that has not been done before. Many people spend the majority of their time at home, and for individuals with OCD, that means that many of their compulsions and distressing thoughts are taking place within the home. It's been found that being able to also complete treatment in the home at the place where most of these compulsions are happening has had a great benefit on their overall treatment and their overall stress levels and quality of life. So what's next? There are limitations to online cognitive behavioral therapy that should be addressed. Firstly, for individuals who don't have access to technology or have a limited understanding of technology, such as those in the geriatric population, then video conferencing technology might be more difficult for them to use. Continually, many of the studies that have currently been done on online cognitive behavioral therapy have been done on children and adolescents because of an issue being able to set up this technology for the geriatric population. So this would be an important area to further study. Overall, the implementation of online cognitive behavioral therapy should be an option that doctors provide to their patients. This in no way should take over for traditional cognitive behavioral therapy, as both have been found to be extremely successful. We are not replacing it. This is just another option. Some people prefer to have treatment in person, but some people would prefer the versatility of having an online treatment option. Overall, online cognitive behavioral therapy could be hugely beneficial in opening the doors for many people to receive the care that they need, when they need it, where they need it. Thank you.